Well, it's nice to see everyone today. Some new faces as well as old ones. Not old as in. Yes, that's right, delicate. So I've been tasked to talk about the prevalence of PBC in Canada, and I'm going to have to ask you questions because I'm not completely sure myself. So PBC is quite a rare disease, and it probably occurs somewhere between 1 in 2,000 and 1 in 3,000 people in Canada. So that's where we sit at the moment. So the incidence is how often PBC occurs every year. So that's a function of numbers in the population and time. And that the incidence is somewhere between 10 to 50 patients every million years. So it's, if you want to think of it, frame that somehow, it's about tenfold less. The incidence is about tenfold less than the prevalence. So we know there's a marked increase in females to males with PBC, and we really don't know why that is. No one knows. I personally have a bias to thinking that the virus that I work on, it actually has got female hormone sensing apparatus, and when you have female hormones, it turns the virus on. So that's still theoretical, so we don't know about that. The disease is rarely seen in children. We actually did have one patient in Alberta who probably got the disease around the age of 10 and 11 and had their transplant when they were 20. But usually it's middle-aged women. We also know that the disease is more aggressive in younger patients, which is really odd. But if you think of just genes, if PBC was just due to one gene, then if that the younger a person developed disease would mean that the effect of that gene was faulty earlier in their life. So therefore, the younger you get the disease, the worse the disease is. I don't know if I explained that very well, but we certainly see our young patients going to transplant more frequently, and the young patients that go to transplant often will get recurrent disease as well, which is a shame. PBC is associated with other autoimmune diseases. So if I see someone in clinic and I think they have PBC, I always ask, are there other autoimmune diseases in your life? Do you have like thyroid disease, which is the commonest autoimmune disease, and or in the family as well? So the fact that you do have these other autoimmune diseases linked to PBC in the family is also indicative that genes play a role in the disease process. And we also know that if you have your children later in life, that's protective. So if you take hormone replacement therapy, when that was a thing, or if you have your children earlier in life, that can predispose you to PBC. So there's this idea that female hormones do play a role in the disease. So one thing we do know is that the prevalence of PBC is increasing worldwide, and we don't really know why. So we know the incidence pretty much is staying the same, but this graph shows you that in most countries the incidence is, the prevalence is going up. So we don't know if that's because PBC is being identified more often, we have better techniques for diagnostics, or whether sort of physicians have a better grasp of diagnosing the disease. We just don't know. So is anyone from the Maritimes here? Excellent. Okay, BC. All right. Now, by show of hands, who thinks that BC has the highest prevalence of PBC? 1, 2, 3, 4, 5. Not sure. Okay, show of hands, who thinks the Maritimes has the highest prevalence? Whoa. So none of the physicians are joining in. I don't think they really know. How about Albertans?
You're asking about geography of Canada. That's really unfair.
Albertans. Okay, well, this shocked me. This is a study with Eric Yoshida that we did. So, yeah, the Maritimes win. Who'd have thought? I thought Hurt and Albertans would be right up there because you know, we see a lot of PBC, and actually BC is one of the lower ones. So, I'm sorry. Well, you see, Quebec don't play games. They, you go and ask them something to go, what? So, I mean, well, it's difficult getting information out of Quebec. So I apologize to Quebecers. I'm allowed to be rude about Quebec because I'm half French, he lied. So, why is the prevalence, yes? Yes. Well, I'm coming to the coast. I have a problem with coastal, though. I was talking with the good Dr. Wallach behind you yesterday about the coast. The problem with the coast is everyone lives there if they could, right? So if it's high around the coast, it's because the population may be high. I mean, who knows? Liver transplant in Canada. The prevalence of transplantation PBC has fallen. And Gideon gave me a really nice slide once that showed that it fell in France with the use of Urso, and then the UK sort of came in behind as they started prescribing it properly to all the PBC patients. So PBC clusters as well. I mean, it's been reported to cluster around a water supply in the UK called the Rivlin water supply, a reservoir. It's been known to reported to cluster in these Superfund sites, these slag heaps, if you will, and coastal BC. So we've got the coast in and Alaska. Now, when I grew up, actually I did a study with a very good friend of mine, Eric Gershwin, in the US, when we looked at this, and PBC patients were predominantly middle class, as judged by having a higher income of $40,000 per year than the controls. Now, I think there's some data to suggest that PBC may also be more working class disease, and these data comes really from the idea that you do have an increased prevalence around Superfund sites. In the UK, we're finding a large prevalence around these old coal mining areas. I don't think it's the coal mine that's causing the disease in women. I just think it's, maybe in more working class areas. And certainly in the Midwest in the US, they have the worst prognosis for PBC. Yes?
I'm sorry, I don't understand what Superfund site means.
A Superfund site is where people dump their trash.
Okay.
Now, I don't know why they call them Superfund sites. I don't know. We call them slag heaps or just tips in the UK. Yeah.
So I grew up near a Superfund site in New York, and it was actually a toxic waste dump.
Yeah.
And so the government actually helped to clean them up. So worse than just trash. It was really high toxic concentration.
Right. So I totally agree with that. It's a concern. It's something we should consider. But I used to live in Louisiana, and we used to have this thing called the Cancer Alley. And it was pretty much the same thing, where we had a lot of industrial toxins from Baton Rouge down to New Orleans. And we did not have an increased prevalence of PBC, but you can always sort of call these sort of environmental toxins an issue. I think that's fair enough. So, coming close to the end, so here's the elephant in the room. We can see that the prevalence, as I said, in Canada and the US is much the same. Now, where you see it's less, some of these are old studies, and the disease is far less in Australia and New Zealand, which is interesting. I don't know why. But the elephant in the room is coastal BC. So the prevalence there is approximately maybe 1 in 200 in First Nations. And that's an approximation because the studies haven't really been done. And this is work by Laura Arbour and Eric Yoshida. And they noticed that patients going to transplant First Nations, half of them had PBC and a quarter of them had autoimmune hepatitis. So this meant that, the First Nations really did have a far worse deal of PBC than other people. And we really do not know why. There's this idea about genes and environment, and it's something I was trying to study. There's one gene that is associated with PBC that will give you a 3 to 5 increased risk of disease, which is called the DR8 gene. And this is just the family, a First Nation family, where the disease almost acts like a single gene disease, like 1 in 4 people gets the disease. So there's one gene which is rare in Europeans that causes 3 to 5-fold increased risk. It's called DR8. And here's a little map of the world that I made last night after the Raptors game, so it might not be accurate. And this DR8 gene here, you can see in Europe, is rare. So it's about 2 to 5% of Europeans will have this gene. And what that means is that it's been lost in Europe over the years because it either provides disease or it doesn't help people progress in their lives. So rare here, but if you look in Africa, in China and South America, the gene is much more common. And this is probably a gene that used to help us way back when, as we came out of Africa and marched up through China into the Bering Straits and over the Bering Straits into the New World, America here. Now, what I'm showing you here is the Dene First Nations. They have a 19% of them have this gene. And if you look at the Cree, 32%. So we know that this gene that gives you a 3 to 5-fold increased risk is much more highly expressed in First Nations, but we don't know about the actual First Nations in BC. We're looking into that now. So that's one idea of why a disease may be worse in one ethnic population. So PBC has increased prevalence worldwide. We don't know whether predisposition is related to genetic risk, but it likely is. One of the things we're trying to do as physicians is actually make a correct diagnosis in our Aboriginal First Nations to ensure that they are properly diagnosed and therefore treated accordingly. And as to the last question, whether PBC is still a middle-class disease, we don't know. We're going to have to do more work. Thank you.